The World Health Organization is warning that malaria-related deaths could double in sub-Saharan Africa. That's because of disruption caused by the COVID-19 pandemic. Goodbye Malaria CEO Sherwin Charles is joining us now via Skype to discuss the impact of this. Sherwin, good morning and thank you very much for your time on eNCA. I mean, hearing the World Health Organization this weekend a warning that in sub-Saharan Africa we could see more than double a death rate this year from malaria disease must be very concerning to an NGO like yours, Goodbye Malaria, that in Southern Africa has been really making progress over the last decade.
Thanks very much, Dan. Absolutely. We are at risk of losing the progress that has been painstakingly made over the last 20 years. And this is what the WHO report highlights. Now more than ever before, it's vital that malaria endemic countries and the world work together to protect the gains that we have made in malaria, both with the number of cases as well as the number of deaths over the past 2 decades. So we are at risk at the moment to see the rise in deaths from malaria to escalate to more than 800,000 this coming malaria transmission season.
Is it because COVID-19 is redirecting health emergency and programs for treatment and prevention like yours, Goodbye Malaria, like the fight against malaria in Africa, which we know kills, as you say, about 400,000 people every year?
Absolutely, Dan. It's a number of factors. The first factor being that we know during the height of malaria transmission, hospitals tend to use at least 70% of their beds for malaria cases. These beds now become unavailable during the COVID environment we find ourselves in. So the access to healthcare becomes a challenge. Secondly, the symptoms of malaria and COVID, there's some similarities, particularly in the flu-like symptoms and that of a fever. And what we've seen is people are being asked to self-isolate rather than to be tested for malaria and given the shortage of test kits for COVID.
So when people are exhibiting symptoms of flu and fever, it is assumed that it could be COVID, therefore they must self-isolate.
Yes, and so what's not happening is a malaria test has not been done before self-isolation is being suggested. And thus we're getting less people getting access to malaria treatment. The third thing is that the supply chain for malaria has been impacted by the COVID environment. And so we're seeing shortages of test kits, of therapeutics within the communities right now as we try to get these supply chains back online. And then the last thing, Dan, is the impact of PPE on malaria control programs. Of course, a lot of the programs, the interventions to protect people include going door to door. And so the community health staff need to be protected. And we find that the shortage of PPE has had a huge impact on control programs being able to continue their work before the transmission starts, which is generally from September onwards.
And then, of course, your organization, Goodbye Malaria, in Southern Africa, including here in parts of South Africa where there's been some small incidents of malaria in neighboring countries like Mozambique, Zimbabwe and elsewhere, you've been also helping those people on the ground there, for example, distributing the mosquito nets as an example. That's also been affected, one would guess?
Absolutely. Dan, we've seen at least a 30% increase in costs to continue our malaria interventions on the ground. We've seen huge impact in the way we train. So today you cannot have a gathering of more than 50 people at most. We normally train 200 to 300 people at a time. And so our training techniques and training programs had to really change, and we're using innovation at the moment to train people within their communities. What we also seen with the net distribution is that it takes a lot more people now to distribute the nets to every single household within a community. And so the programs really have to focus and a lot of determination required to get over the line. The other challenge is government is starting to divert funding normally allocated to malaria towards the COVID fight. And that's a huge risk for programs at the moment.
Is it possible, very briefly, Sherwin, I'm not trying to say which is better and compare, but the reality is malaria kills about 400,000 people every year, even before COVID-19 on our continent, and our region, Southern Africa, is not free from that. 800,000, if what the World Health Organization is warning that malaria-related deaths could amount to this year. That's a big number. That could end up being more than what COVID-19 might kill people in Africa, or is that not a fair comparison?
Well, I think it would be a fair comparison if you're looking at it in the immediate. We certainly don't know how COVID will play out over the remaining of the year, and is there a second wave or a third wave. But what the reality is, we're fighting a war against COVID. And what we're now seeing is an old foe raise its head in our weakened state. And so malaria cannot be forgotten. The sad reality of malaria deaths is that it affects our young children. It affects children under the age of 5 predominantly. And so more than 70% of our deaths would occur amongst young kids. We cannot have the ravages of malaria today killing our children, whilst our seniors are being lost to COVID. This is absolutely unacceptable. Malaria is a disease that we know how to control, we know how to treat, and we know how to prevent. So we cannot lose our focus right now on malaria during these tough times.
Thank you very much. Sherwin Charles, the CEO of Goodbye Malaria, speaking to us on the back of the warning this weekend by the World Health Organization that malaria-related deaths are set to double in sub-Saharan Africa, from about 400,000 to about 800,000. Many of those deaths might be children, and he's appealing there for governments not to take their focus away from fighting against the old foe, as he says, malaria.